Hi, this is Emma Krasansky in collaboration with Dr. Christopher Steele presenting Health Equity Teacher Module, Implications of Health Literacy. The objectives of this module is that by the end, learners will be able to define health literacy and the skills required for proficient health literacy, describe the epidemiology and risk factors associated with limited health literacy, and identify and explain the impacts that limited health literacy can have on an individual's health. So to begin, let's talk about what health literacy is. People may be familiar with the concept of literacy in terms of learning how to read and write growing up, but health literacy is the degree to which individuals have the capacity to obtain, process, and understand basic health information and services needed to make appropriate health decisions. Essentially, someone is health literate if they are proficiently able to navigate the healthcare system, understand their conversations with their healthcare providers, self-manage their healthcare, things like these. And it really breaks down to skills that allow for that literacy. Those skills include basic reading skills, document reading skills, writing skills, interpersonal communication skills, and the ability to use numbers for computation, measurement, and risk assessment. Health literacy is not just an all or nothing thing. It is a spectrum. So there's different levels of health literacy. Below basic health literacy can be exemplified by being able to locate only straightforward pieces of information in short, simple text or documents. So that's at the lowest end of the spectrum. As you increase across the spectrum, we have basic health literacy, which is when people can find a little bit more complex information in short text and simple documents that are somewhat longer and more complex than those at the below basic level. Intermediate health literacy continues in complexity, interpreting or applying information presented in complex graphs, tables, and other health-related text documents. And proficient health literacy can be something like being able to draw abstract inferences, comparing and contrasting pieces of information, and applying abstract or complicated information that's from text or documents. So individuals can be anywhere on the spectrum, and they can also be mobile and increase their health literacy by gaining certain skills. Why is health literacy important for us providers to know about is that patient-centered care with shared decision-making, which is typically what we strive for as healthcare providers, in order to have that patient-centered care and shared decision-making, it requires for patients to have good health literacy. Patients need to be able to communicate their concerns with their providers, understand written and verbal instructions that providers provide their patients. Patients need to be able to partner with the providers to make these decisions together when it comes to certain screening and treatment options. And patients should be able to engage in self-management to allow for appropriate care for their conditions at home. As well as patients need to be able to negotiate a complicated, often fragmented and difficult to coordinate healthcare system. Essentially, if patients have limited health literacy, their ability to interact with the healthcare system, healthcare providers, and really take control of their health is also limited. So as healthcare providers, we have to acknowledge health literacy and limited health literacy within our patient populations and work effectively to promote health literacy as well as provide care that requires minimum health literacy. Now, some epidemiology about health literacy. In 2003, it was found that only 12% of the United States adults were proficient enough in health literacy to understand and use health information effectively. As you can see in this pie chart, we have 12% of proficient health literacy, 53% intermediate, and then 21% basic, and 14% below basic. So that is a very small portion, 12%, that's actually able to fully optimize their healthcare with their health literacy skills. Now, we do see that there are disparities within health literacy, and that health literacy is more limited within minority populations. 66% of the Hispanic population are limited in health literacy. 58% of the Black population are limited in health literacy, and 48% of the Alaskan, Native, and Native American populations are limited in health literacy. So it's important to acknowledge those trends within populations and be aware of them. Now, those are population statistics, but on the individual basis, what makes someone more at risk for having limited health literacy? And one of those things is being older than 65 years old. Another is having a chronic disease, being part of a minority populations group, which we've already discussed, being an immigrant, having less than a high school education, experiencing acute illness or anxiety over a new diagnosis, not speaking English, and living below the poverty line. All of these factors in some way, shape, or form affect an individual and limit their health literacy skills. The implications of limited health literacy are what makes it important to acknowledge as healthcare providers. So having limited health literacy makes it more difficult accessing healthcare and then navigating the healthcare system once you've accessed it. Patients with limited health literacy have been seen to be more passive during encounters with providers, asking fewer patients in the appointment. Patients have more difficulty understanding their conversations with providers and the explanations that providers provide about medical conditions, treatment plans, and medications when they have limited health literacy. They also have less general knowledge about their health, their illnesses, and health care. Greater difficulty with medication management and poor rates of medication adherence is a huge trend within limited health literacy, within limited health literacy populations, which we'll get to further on, as well as more difficulty with self-management and follow-up activities. So individuals who have limited health literacy may have difficulty managing their care afterwards because they don't understand the conversations with their providers, the explanations that providers give, treatment plans, medications. That all makes it harder than to care for yourself when you're not with the healthcare provider. So all these limitations and implications that limited health literacy has on patient behavior, patient ability, when it comes to navigating and understanding their healthcare, create for major health impacts. So health populations with limited health literacy, we see lower health insurance rates, especially among children. We see that they seek care later in the progression of disease. So by the time they get to the healthcare system, they are in a severe state of disease, and then that influences their outcomes. We see that limited health literacy patients are associated with higher rates of chronic illness, as well as worse chronic disease outcomes, which does make sense with the previous slide, how we discussed that those with limited health literacy have difficulty understanding provider instructions, treatment plans, medication regimens, so they're lesser able to care for their chronic disease. We see that those with limited health literacy have higher rates of hospitalizations and emergency visits, maybe as a product of those higher rates of chronic illness and worse chronic disease outcomes. We see decreased rates of preventative services used, so decreased mammography, vaccination rates in limited health literacy populations. We also see higher rates of depression, higher mortality rates, and also just lower all-around health status in these populations. So clearly, patients with limited health literacy are at risk. Their health care is at risk, and as medical providers, we need to be aware of this and take the actions that we can to navigate health literacy with our patients. And this diagram I thought was a great pictorial representation of just how impactful health literacy is for patients. So say you have a sick patient that seeks medical help. They arrive at the doctor's office and the staff offers them complex, confusing instructions, whether it's forms, telling them what to do, and then to go off that, doctors can explain conditions and treatments using medical jargon, the doctor gives them prescriptions for this condition that they've come for. The doctor does not then confirm the patient's understanding. So all these actions through the staff at the doctor's office and the doctors themselves will exacerbate this patient's limited health literacy. And then the patient's at home with these complicated instructions that they don't understand fully. If no one follows up on the patient, that makes it even worse. Patient then can incorrectly manage their care, incorrectly take their medicines, follow instructions, and the patient's condition gets worse because of this. They didn't understand the treatment plan, and now they are suffering due to that. So they then go to the emergency room because their disease or illness has been exacerbated. And the staff there, that wasn't the original staff, is now giving them new treatment plans, new prescriptions. And again, the healthcare system does not confirm the patient's understanding of these instructions. So then the patient is then discharged again with new instructions that they do not understand, and leading them to continue with their illness. And then it's a cyclical nature that they just continue through this cycle of not understanding their treatment, not understanding their healthcare plan, and not being involved with the decision making. So their health continues to suffer over and over again. Again, this is a general diagram that can be applied to several situations, and this may not occur for all limited health literacy patients, but they are potential scenarios. That brings us to the end of our implications of health literacy presentation. Next, we'll be discussing how to navigate limited health literacy within our patient populations, whether it's through interpersonal actions with our patients, systemic actions, or communication strategies. So stay tuned.